Hey guys, Dr. Adam Seay here. I want to take a minute to share with you a little bit about detoxification. The name of this video is Detoxification Made Simple, and it is not a simple process. It is a very complex, a very detailed process that has, lost a lot of people, myself included. So I tried to learn from what other people have done in this field and try to make it as simple as possible so that you can understand it better and some of the reasons behind why it's important to detoxify. So the purpose of this video, again, I have a disclaimer here, is not to undermine the whole detoxification process. There's a ton of people on the internet and on YouTube, and they have PhDs in how the body works and liver detoxification, and people that have discovered phase 1, phase 2, phase 3. All of those things are very complex. I encourage you to dig in more. Watch those videos. There's a lot of great people out there explaining more of the science behind this. I'm going to go into that a little bit, but we're not going to really beat you up with it. We're going to kind of hit the highlights for you. But again, detoxification is an extremely difficult and complex process to understand. This video is not intended to undermine the complex nature of the subject matter. So again, to those that know it in and out, we're not trying to dumb that down to a level that is undermining them. We want to keep it as simple as possible, but again, this is a very, very complex component. Detoxification is a vital component to your physiology. Your body has to break down toxins and eliminate them so that you don't end up damaging your own body. So this is a process that your body has to take in and kind of break those things down so they don't build up and cause harm to you. So every person on the planet comes into contact with toxins on a regular basis, from heavy metals to BPA to organophosphates, which are like pesticides, and also Roundup, or what's known as glyphosate. No one is above these things. They're going to come into contact with them on a daily basis, and there's a ton out in the environment. There's a ton that you come into contact with when you're at home, when you go to a business, when you eat food. So again, what we look at is we have to do pretty much maintain the amount that your body can discard, rather than you're not going to be able to eliminate your sourcing for these just because everybody on the planet comes into contact with them. So again, detoxification and inflammation are actually inversely related. What I mean by that is when detoxification goes down, inflammation is going to go up, and vice versa. So when detoxification goes up, your inflammation is going to go down. And what does inflammation do? It does everything just about to your body. It causes pain. It causes a leaky gut or intestinal barrier system. Your blood-brain barrier system gets influenced by inflammation. Just about every chronic degenerative disease in the United States is a disease linked to inflammation. So you definitely want to keep that down as much as possible. So the organs involved in detoxification include the liver, gallbladder. You're going to have your kidneys, your intestines, and also the lungs and the skin. The last two not as well known. I mean, most people understand the skin and the lungs, but we're going to look at the main players, which are going to be your liver, your gallbladder, your kidneys, and the intestines. So you may have come across those that say detoxification is, you're just fine, you don't need to worry about it, your body does it, you don't need any help with it. Well, this isn't correct, because again, not every person's the same. We don't all have the same physiology. We don't all, our bodies don't work the same. That's why we're unique in what we do and who you are. So your body doesn't work and the same as somebody down the street or your next door neighbor or your brother, your sister. All those, we're unique to ourselves. All those things are different in each person. So what many people don't realize or look at are SNPs. These are known as single nucleotide polymorphisms that prevent you from detoxifying correctly. So these things can really hinder your ability to do that. SNPs are single nucleotide polymorphisms that I mentioned before that can occur in enzymes that are coded in your DNA. These SNPs can prevent certain enzymes from working correctly, and in turn causes issues in your physiology. So there are tons and tons of these. It's getting into the realm of epigenetics. You may have heard of that term, looking at what happens above the genes. But these polymorphisms are very, very important to how your body functions. It's not the end-all, be-all to how your body functions. You can have these. These are blueprints when you have those examined, but it can affect your physiology. And so there's ways to look at that. Some of the big SNPs involved in detoxification are COMT, NAT, SOD, what's called CYP, MTHFR, PON1, CBS, and GST. And to go over these just briefly, again, this isn't a video on SNPs and genetics, but we'll just hit the highlights again. COMT is catechol-O-methyltransferase. This is involved in so many different processes. It's involved in a lot of your estrogen detoxification, so it's a very important player. NAT works on some of the mitochondrial aspects of detoxification. SOD, superoxide dismutase, is what helps to break things down to reduce neuroinflammation, and it's kind of like a free radical that can form. The other one is your cytochrome P450, and this is what most people associate with phase 1, phase 2. Liver detoxification is controlled by the cytochrome P450 enzyme. MTHFR, this is your ability to make methylfolate. If you don't have that one, you're not going to cycle around to get homocysteine down, which can cause problems downstream as a toxin. PON1 is going to be your organophosphates and also your Roundup or glyphosate. So if you have PON1, could be shorthanded in your ability to handle Roundup and glyphosate, or organophosphates, sorry. CBS is going to be your cystathionine beta synthase, and that's going to be helpful in your sulfation pathway and whether you can develop sulfite toxicity if this one is really turned on and wreaking havoc on you. And then GST is going to be your glutathione S transferase, which is going to help work with glutathione to help your liver and your body detoxify. So in addition to SNPs, you can also have heavy metals. You can have organophosphates, as we've mentioned before, BPA, phthalates, dioxin, biotoxins. You can also have PVCs that come from the environment. You can have endotoxins that are coming from gram-negative bacteria. You can also have glyphosate or Roundup, and much, much more. I mean, they tell you, even the CDC has recognized you can't avoid flame retardants. They're everywhere. Everywhere you turn around, you're going to come into contact with flame retardant. So again, these are everywhere for us. So we got to work on our bodies to get our bodies able to handle these better and to discard as much as we can. So the dumbed down overview of detox, and again, not trying to be harmful in the whole detox process. We're just trying to keep it simple. We're using the KISS principle here. Goes at the cell. So everything kind of starts at the cell. You got to have a healthy cell kicking out and has that ability to detoxify. A lot of transport mechanisms that start there. Your mitochondria is there. You have other things like the Golgi apparatus, and all the other constituents of the cell have to be healthy. You want to kick that out, get it into the blood. From the blood, it's going to go to the liver, then out to the gallbladder, and then from the gallbladder into the small intestine, and then out as waste to be eliminated. This is the preferred method. This is what the body usually will do. Sometimes too, you have the ability to, once it gets into blood, can go to the kidney and also can be eliminated as well. But the kidney just isn't as well designed as the liver is at handling a lot of this volume. So the kidney does handle some to a degree. So when toxins are present, they go through 3 phases before they are eliminated from your body. So the first phase is going to be an activation. It's called phase 1 conjugation, and it's an activation process. Phase 2 is going to be mobilization. So it's going to start to get it moving to get it on to the next phase, which is phase 3, which is elimination. So those are the 3 phases of detoxification that your body goes through. Phase 1. This phase involves converting lipid-soluble compounds into water-soluble components or compounds, and these are typically more reactive than the original toxin that is made. So it's like creating something that's about to blow up, and then you hand it off to the next phase. And that's kind of what phase 1 does. The main enzyme involved there is going to be the cytochrome P450, which we mentioned before is a common SNP in a lot of people. Phase 2, this phase is going to be the one that takes that highly reactive water-soluble bomb, and it's going to further increase the solubility, kind of deactivate that so it's not going to explode or cause more problems, and reduce its toxicity. There are several enzymes involved here, but one of them is NRF2 that is involved in that. Glutathione S transferase is also one that are the more notable enzymes involved there to help in phase 2. So a lot of times phase 1 works pretty well in a lot of people. Phase 2, maybe not so much. And so sometimes that's where people get stuck, and then that causes problems in their ability to detoxify. Phase 3 is going to be taking water-soluble toxins needed. These guys need transporters to be excreted out of the cell. So there are several things involved there, but in the liver, the transporters will move toxins out of the cell into the bile to be eliminated. So one of the things too that you have to have good bile secretion and bile manufacturing from the liver to help grab onto these toxins as well. The intestines and kidneys, toxins are pulled from the blood and removed from the body. So again, it's just highlighting how that elimination process works. The main enzymes involved here are ATP binding cassettes. They're sometimes labeled ABC. There's also another one that's just like MR2, which is multi-resistant PEPT protein or peptide 2. They're the main transporting enzymes. OATP is another one involved in that transporting mechanism of getting it out into the small intestines from the liver and gallbladder. So fat-soluble toxins have an affinity for several things. They're going to have an affinity for your fat. They're going to have an affinity for bone marrow, liver, your central nervous system. Water-soluble toxins have an affinity for your joints, your tissues, your blood, and also your muscles. So a lot of systems and a lot of areas involved with both fat-soluble and water-soluble toxins. So what conditions are the result of excessive toxin load? So you can have acne, skin rashes, you can have allergies, you can have or arthritis and joint pain, you can have autoimmunity. Very common to see, cardiovascular issues, cardiovascular disease, stroke. You can have chronic fatigue, you can have constipation, you can have diabetes, fibromyalgia, headaches. You can also go into hormone imbalance, inflammatory disorders, Lyme and mold. This is notorious for messing up your detoxification and just really, really wreaking havoc on you. And then any type of neurologic disorder. And sometimes these two alone can cause all of these problems because they do mess up your detoxification. So if you're dealing with Lyme or mold, that's a whole separate issue. We have a whole separate video we'll have on that for Lyme and mold. This is more on the detoxification side, but again, these two are big players in messing with your ability to detoxify. Okay. All right, so what creates disruption in the three phases? Glutathione depletion is going to always cause issues. So you can kind of do a fast phase 1. I always kind of call it that, where the body's really good at just kind of changing this over and say, okay, we're done here, go on to the next level. And the next level is like, I'm short-handed, I don't have enough. So now you've got this thing that's kind of causing more problems than it would if it was just by itself and not messed with. So in some cases, if there's glutathione depletion, you're going to have problems with that. You can also have SNPs, so those single nucleotide polymorphisms that we went over earlier can cause problems in your ability to run through those three phases correctly. Heavy metals are going to bind in a lot of those areas too at the cellular level, also in those enzymes, and they're not going to allow those three phases to run correctly. You can also have bacterial endotoxins, what are known as lipopolysaccharides. And so these will wreak havoc on every part of the body, especially the blood-brain barrier, the liver. I mean, the research is well documented on what LPSs do to the body. Lyme and mold, like we mentioned before, these guys are notorious for just disrupting your detoxification, and that's how they thrive and how those mycotoxins will build up in mold cases as well. And then inflammation. Again, when your detoxification goes down, inflammation is going to go up. So you're going to see that inverse relationship with those. So how do you find these disruptors to begin with? So several different things. These are a lot of things that I use in my office to help people. You can do organic acids to check for your glutathione ability and how well you're detoxifying. So I always tell people organic acids are like a dam. So if you can imagine, you've got a giant reservoir of water that you've blocked. Occasionally, they want to let some of that water out. They'll open up one of the maybe channels, and some of that water will come out from the reservoir, and they can close it back. So if you have a pathway in your biochemistry that is stuck or blocked, you're going to start spilling organic acids out through your urine, and these can be detected, and they just trace it back to your biochemistry and find out, yes, you have a decreased ability to make glutathione. You want to probably get your glutathione system up and running and get better manufacturing or better production of glutathione. Genetic testing for SNPs. So there's several different places that does this, from Ancestry.com to 23andMe.com to other companies that run these as well. We always want to look at SNPs that you have because that can give us a blueprint or a roadmap to what your body has, which mom and dad have given you and maybe made you a little short-handed on your ability to detoxify. Another one that can be tested or together is the mercury tri-test, and also checking metals for heavy metals. So we sometimes do both. We may go into the tri-metals or the tri-mercury test and blood metals, or looking at hair. You kind of run both of those in the test through mercury. This one was done by Quicksilver Scientific. They do, I think it's the only test that looks at inorganic versus organic mercury. And it's done 3 ways. You can test through blood, hair, and urine. So all of those together can split out and see. Dr. Seay, who owns that company, has a patent on that particular process called mercury speciation, where they can actually split that out into organic and inorganic mercury. The problem we see sometimes in hair analysis is we don't always get chronic mercury. We do use Cutler's counting rules of 3, which can give us some insight on the doctor's data test that we do use in people. But sometimes we'll find this person has had a history of amalgams, and those amalgams that's the inorganic mercury, and you don't always see that on a hair analysis. It's a little bit more difficult to pick up. So this is another way that can also test and check kidney function, look at any damage that may be occurring from metals to the kidney. You can do stool analysis and leaky gut panels for endotoxins. So you want to check to see, do I have dysbiosis or bad bacteria? There are places that you can find antibodies to lipopolysaccharides that tell you, yes, you have a leaky gut. And in particular, you're having a reaction from gram negatives because those lipopolysaccharides are showing up in the blood as antibodies. And then I like to use the DNA connexins for Lyme. This one I feel like is by far a ton more accurate than what's out there in the traditional realm. This is a urine PCR test, and the reason this one's so great is because this guy in particular, which is Lyme disease, doesn't like the blood. So a lot of people will test blood looking for Lyme. This thing just doesn't stay there very long, so your antibodies will change based on that. But what this test does is if you can squeeze out some of these maybe partial fragments of DNA into the lymphatic channels to get out through the kidneys and out through the urine, you're going to pick up some of this, that they can amplify that through PCR. So I feel like this one is a much more accurate test when it comes to picking up Lyme disease. And then there are several inflammatory markers that can be tested as well, but both through blood and stool, that you can pick up that, yes, you are inflamed. So if we look at organic acids, this is, I think, this one's through Genova Diagnostics. So here is where we're going to look at glutathione. So these particular organic compounds that are coming up, in the urine from that blocked pathway is telling us, yes, there's a glutathione issue. We definitely want to bump that up and improve that person's glutathione status. The next one, this is just a brief example of a genetic SNP report. So it's very hard to read, but up here is COMT, there's MAOA, MTHFR. Looks at all those SNPs. So the homozygous is going to be red. So if you have 2 copies, that's going to be 2 copies of a defect. The heterozygous is going to be yellow, which is 1 copy, and the green is going to be okay. So there's no copies of a defect there. So this is a great test. Again, it's a roadmap or a blueprint. It doesn't tell us that this is your physiology. It just tells us this was you have the ability to do, but not a guarantee of what may affect you from a physiologic standpoint. Again, genes are a blueprint and should be treated if they're affecting your physiology. And genes can turn on and turn off. So that's the beauty with your genes. You're not the victim of your genes. Your genes are not static. They're dynamic based on the environment in which they are in. We look at Quicksilver Scientific's mercury tri-test and blood metals. So here's the mercury tri-test. Here's the organic versus inorganic mercury. And then here's this urine to hair results as well. So here you see down here in the bottom that result in the urine to hair or urine to blood ratio. Here's that hair to blood ratio as well. So a great snapshot of what organic versus inorganic's doing. And then you can pick up the blood metals as well. So you're going to look at arsenic, cadmium, cobalt. They will run mercury in that, obviously, and a couple other things as well are tested there to see if heavy metals are a problem for you. The other one, this is the Vibrant Wellness Wheat Zoomer. And this is a great test to check. They roll into not only testing for gluten and wheat issues, but they also test a leaky gut panel. So when we look at, here's the lipopolysaccharides that they will test, and this is an indicator that yes, endotoxins from bacteria. So if we see these are elevated, then we know you've got gram negatives in your body. We got to clear those out, and you're going to see those antibodies ramp up when they're present. So again, that's going to be endotoxins that are affecting your body to, in particular, your ability to detoxify. Here's another one too, and I kind of jumped over it, but we do look at a lot of times the oral cavity, and the mouth is huge when it comes to everything in the body. So this is actually a test called Full View by DNA Connexins. So they run this test as well, in addition to the Lyme panel. And they'll test for bacteria, fungus, parasites, and viruses in the oral cavity. And so the oral cavity can be a large source of endotoxins that can enter into the blood. So kind of banking on the endotoxin side of things, again, these are a lot of different organisms that they're running through. So anything above 9, which I know is very hard to see, but there are several things that go up above that level of threshold. And so that tells us, hey, yeah, there's a lot in the oral cavity that needs some addressing, because these things can produce endotoxins too, get into circulation, disrupt your blood-brain barrier, disrupt the gut, cause so many downstream issues, and we want those out. And a lot of times the teeth is a very common hiding place for these things. So here's the DNA Connexins PCR urine test that is good for Lyme and co-infections. So the other beauty with this test is not only are you running for Lyme, but you're testing the co-infections with it. So they highlight what shows up. Here's Borrelia burgdorferi. There's 2 different surface proteins that test, Babesia test, and then they, on this particular sample, show you an Ehrlichia that also tests. But they'll also test for Bartonella, Babesia, Anaplasma, Ehrlichia, and then Borrelia, and a couple other species of Borrelia as well. So it's a great test that can give you insight whether you, always say with Lyme disease, it rules in, it doesn't necessarily rule out, but it will rule in that maybe Lyme disease is an issue for you. For inflammation, you can look at several different markers. Ones that we tend to look at can be CRP, which is high sensitivity. You can also just do regular CRP, which is C-reactive protein. You can do your SED rate, which is ESR. You can do ferritin, which is a good predictor of your iron status, but also can be an indicator of inflammation. Tumor necrosis factor alpha, interleukin 1, interleukin 6. There's some other interleukins involved with inflammation. You can also look at calprotectin as well, which is usually one that can be picked up in the stool for inflammation in the intestines. So how do you fix issues with detoxification? It's great that we kind of went over this very simplistically, looking at ways that we can pick up issues with detoxification, but how do we do it? And the answer to that is you have to be very specific, because this process is very complex, so you don't need to just go at it and start shooting in the dark, especially if you're sick. So you got to really, really hone in on someone who knows what they're doing, and I always recommend using a healthcare provider to do that. It's not as simple as, a colon cleanse or a liver cleanse that your friends or people on Facebook say, well, I just did this colon cleanse and everything got better. In a lot of cases, especially if you're sick, you may end up getting worse. And so that's where you have to have someone who knows how to cipher through this information and really hone in on what's going on for you. Because again, what works for someone may not work for you, and vice versa. Everything, each person's unique. So you have to understand roadblocks that one can encounter along the way. And this is, as I mentioned before, you can have downregulated issues like NRF2. So if you have NRF2 and that particular gene that's turned off, some things that are actually really, really great for your body to detoxify can then become toxic to you. So you have to know how to troubleshoot this and actually how to turn this one back on. You can also have endotoxins. You can have sulfite toxicity, and you have to know how to balance through that if you come up to it. And you have to look at particular block transport proteins, heavy metal issues, food sensitivities. Again, you see how complex this is. So definitely a shot in the dark is not the best way to approach this. You need to do it from a multifocal standpoint of looking at every aspect that you can to get this better. So you have to test to see exactly what you need. And that's why we went over those tests, because that's what we do in the office. We test you, we make sure that we find where are you stuck and where can we help you get through that. So if you guess, you might get worse rather than better. So that's, again, what worked for your neighbor may not work for you, so you definitely don't want to do that. So always use a professional to help you detoxify. And I'm definitely one of those. I'd be happy to help you in any way that I can through that. So let's look at how to detox correctly. Step one, you definitely want to reduce inflammation. That's first and foremost. We have to look at foods, because you don't need to keep causing inflammation by the food that you're eating. You want to remove any of those foods that are offending yourself and your body. You want to address any underlying infection that's there: Lyme, co-infections, dysbiosis, viruses, parasites, yeast. You got to work on those. You got to get those down to a level to where you're going to knock inflammation down. And you also want to do nutrient and botanical support during that time to kind of reset the system, get the body supported, because a lot of this is causing problems as well. So you definitely want to support that. Step two, you got to work at the cell. So the cell has to get worked on or get fixed in order to get well. So methylation support is a vital component to getting the cell better. It also has great on the liver. So we usually like to use methylated B complex. Fatty acid support is a must, because the cell membrane is the brain of the cell. And if you look at that, that is a phospholipid bilayer. And so what is great on supporting that is going to be your phosphatidylcholine. Great product to help on fatty acid support and also membrane support. You definitely got to support the mitochondria, because that's going to kick out ATP. So PQQ, CoQ10, resveratrol, there's so many other things that can support mitochondrial function. Again, you want to make sure that you're using the right things, and which one works for you and which one may not. You definitely need to be tested for. You also want to look at metal binding. So things like glutathione, EDTA, other things that we've even used in our office called cytodetox, things that can grab metals and pull them out. So you get those out. Some things that have thiol groups attached to them to get them out as well. It's very important. Step three is going to be supporting the liver and gallbladder. So bitters are phenomenal on the gallbladder to kind of help stimulate gallbladder, get good bile production, get that coming out so that you can clean that area. Because what a lot of people forget is bile is a detergent. And if you have SIBO or SIFO, which is small intestinal bacterial overgrowth or small intestinal fungal overgrowth, one of the issues that a lot of people run into that they never address is you got to get the gallbladder and get good bile, because bile is a detergent and it's going to wash that area. So if you're killing the organisms, you want to wash them out too and get it cleaned up. And great thing to do that is going to be bile. PC, again, great on the liver. Another great product on the liver too is going to be DIM, which is diindole methane, methyl Bs, glutathione, vitamin C with R-lipoic acid. This is a NRF2 activator. So again, some people can't tolerate that. You have to watch them and look at ways to kind of get that supported so that they can. And there are several different ways that we can do that for you if you have problems with that. Step four is going to be the kidney. So you got to get the kidney supported. Bitters are going to work there. Minerals, great there, especially oceanic minerals. Drainage remedies. So homeopathics work very well in the body, especially those that say, I react to everything, I can't take anything. Usually first place you got to work on is drainage, and getting those supported with homeopathics work very well so they can tolerate more. Rentone's another great one that helps kidneys. Another one that we use called K for kidney works very well also on kidney support. Step five is going to be the intestines. There's a kind of a chelating component called IMD. It's an intestinal cleanse that has some thiol groups attached to silica. Great on helping to bind metals up in the intestines that a lot of people have stuck or bound in there. Binders are going to be great. Charcoal, clays, chitosan, all different sorts of binders will work. You want to definitely have binders on board as you're detoxifying. You want fibers on board as well to get the bowels moving, to get some of that to get out of there. We use Clearway cofactors a lot, things that has haritaki and dandelion and other support formulas to really get the body, clearing these things out. And probiotics are also very helpful as long as you don't have SIBO or things that tend to make you aggravated with probiotics. But if you don't have those, probiotics can also be very helpful to get the bowels moving and keep them healthy. So what do I do in my office? Well, step one, we want to establish if a chronic infection is present. So that could be Lyme, dysbiosis, parasite, virus, or yeast, or even mold. Mold is, people end up with mycotoxins as a result. We want to evaluate you for toxins, and we do it several different ways. One of the ways we do it is through kinesiology. The other way that we also test for toxins and for biotoxin illness is going to be through the visual contrast sensitivity. And we also do a medioxy test, which kind of looks at how much oxidative stress your body's undergoing. I always just tell people this is like cellular rust or inflammation that's happening at the cellular level through the medioxy test. We do that to kind of screen people to see what are we up against and what things do we need to go deeper into. The next one is we want to establish laboratory testing that's needed. So if we find, hey, it looks like heavy metals are an issue for you, we're going to recommend some heavy metal testing to confirm that. If we think that, hey, there's a chronic infection here, we want to nail that down and see where it's coming from. We think you may have dysbiosis. We're going to look at those tests for you. So what other things that we do? The fourth step is going to create a plan of action based on testing. So once we get your results back, we're going to come up with, here's our game plan, here's what we're going to do. And the next step is, again, we're going to go through and start reducing inflammation from food, start doing nutrition support, so for helping counterbalance any nutrition depletion or nutrient depletion. And if there's chronic infection present, we want to start with treating those. And so if you have parasites, the first place we're going to start are parasites, because these guys will harbor heavy metals, they'll harbor bacteria. So we don't want to start going down a bacteria or heavy metals when a parasite's there. And a little caveat with that, this isn't a parasite talk, but you're probably not going to get rid of parasites altogether. There's probably somewhat of a symbiotic relationship with these guys. So it's about knocking these guys down to where it's not an overloaded system. It's more a compatibility issue. So we say now, okay, we want to get your body to be compatible with these things where they're not fighting each other. So knocking those down, sometimes you'll release more heavy metals. You can release bacteria. Then you want to start looking at metals, because again, that's when you want to start pulling those out. Then we look at the bigger organisms going down, which is going to be yeast or fungus or mold, and then bacteria, and then lastly, viruses. And then if there's a more acute infection, we want to treat with a broad-based antimicrobial to lower the infective load. So again, it's not that we're ignoring if you have a chronic or a very acute virus or a very acute dysbiosis. We definitely want to drop that down for you immediately, but long-term and end-game is we got to address some of those other chronic issues. You want to detox support is used throughout treatment in my office. So we always are using binders and other things to help clear out any infection and help the body detoxify better. And then we're going to retest approximately every 3 months or so to check progress to see, depending on what shows up and what tests off, that's where we want to see and get a good objective viewpoint of where you've come and where you were before. So I've had great success with doing several different things in the office, and we use the True Cellular Detox. This is a phenomenal process that works on heavy metals, works on clearing out mycotoxins, and works on clearing out biotoxins from Lyme as well. We have used the Detox Cube with EDTA if we find there are other metals on board. We have this ability to try to kick in glutathione. Synthesis is going to be your best bet for mercury a lot of times to get that up and running, get metals out. The Black Box Liver Detox, a phenomenal place for people with, liver issues, cholestasis in the gallbladder, kind of kicking the gallbladder into gear, getting some of those toxins to come out and get the liver supported. The mold and plastic box is another great one for people with mycotoxins, plastic issues. There've been a lot of exposure to BPA or other plastics. And we use many other things as well, but we always test. And that's what we want to do, is we want to test to make sure what exactly is going to work best for you. So your greatest success in detoxification comes from a skilled practitioner who knows what and when to use certain formulas to aid in detoxification. So again, don't guess, don't shoot in the dark. Use someone who's very skilled in detoxification, and don't approach this alone, because a lot of times you may end up worse than before. Some people end up having to have their gallbladder removed because they never worked on the gallbladders, they were detoxifying. So there's so many variables that can happen. Use someone who's knowledgeable in detoxification. You won't regret it. You will definitely be pleased to do that, or pleased that you did. I want to add value to your life. So that's a big thing that I always want to work with my patients, is we want to do anything that we can to add value to you. So how in the world do we do that? It's kind of an odd question, like no one ever says that. But I want to do it for you, because we want to do for you what you can't do for yourself. And that is guide you through that complex nature of detoxification. Because so many people, it's hard to treat yourself, and that's what it is. It's hard to self-treat. It's so hard to pin down, okay, is this what I need? I don't know. I need some help. And that's what we're here. We're here to help you in that process and in that journey of detoxification. The next thing I want to do is I want to coach you in your detox process. I want to give you positive reinforcement, because a lot of times if you're doing this alone, you're going to get defeated. You're going to think, this is not worth it. I feel worse than I did when I started. This is just garbage. I'm not going to do anything else with it. I want to give you help and give you a sense of abundance, so that when you go through this, we're going to look at all the positive minis, not the negative fews, and give you that sense of abundance, not a sense of scarcity, so that you're not worried about, oh no, what about this one thing, when it's like, look at all these positive things that are there. So it just helps you to counterbalance a lot of the things and a lot of the frustration that you run into with detoxification. The other thing that I want to do is I want to equip you with the knowledge to help yourself, your family, and others. Knowledge is power. So when you become equipped with knowledge, you can then help others, and you can turn and help say, look, this is what I did. Let me help you through this. Let me get you connected with someone that can help you, because I went on that journey. And there's so many people out there that are suffering. I can't do it alone. I need you to help me to help others. So the more that you're equipped with knowledge, you can then in turn help others. And that's what this is all about. We want to help others to achieve the life that they were designed to achieve, to have an abundance, and to live out life to the fullest of their potential. So I want to be the first to help. So anything that I can do that can add value to you and to others, would definitely want to do that for you. And the other thing too that helps to add value is I want to listen to your story. So many people and so many doctors don't listen. And that's the problem that's out there, is that you go to the doctor, they spend 5 minutes with you, and they say, I think this is what is going on, here's a prescription for that. And you're like, you didn't even listen to what I said. And that's what I want to do. That's how we add value to you, is we want to listen to your story. We want to interweave our process and our methods into your story to help change your story if your story is a bad one. If you feel like I have no hope, I have nowhere to turn, we want to change that for you. We want to change that pattern for you as well. And I want to know about you. I want to know what's going on. I want to really, truly dig in and help you any way that I can, because in my office, you're not just a number. You're a patient, you're a person, and you're unique, and you're a child of God. And so we want to help you achieve the life that God's created for you. And I'm more than happy to help you in any capacity you want me to. So if you're interested in detoxifying your body, give me a call. I'm here to help. My number to the office is 919-662-0520. I'd be happy to share with you what we can do. Set up a time to go over and listen to your story, really listen to you, get a feel for what we can do to help you. I look forward to seeing you. Thank you for watching. God bless.